My name is Tim Williams. I'm a GP with a special interest in community pain medicine in Sheffield. So principally I'm a GP, but I also spend quite a lot of my time, even in general practice, dealing with people with kind of persistent and chronic pain. I think the main thing for the doctor, the main thing for the GP, is trying to deal with someone with quite distressing symptoms in 10 minutes.
Yeah.
And I think that's always the challenge. And sometimes I think as GPs we can be tempted to just rush that bit and kind of give people some more pain relievers. And really, when you've got persistent pain, just more pain relievers isn't really what's required. What's required is a kind of a whole change of how you're living your life to accommodate the fact that you have got this persistent long-term condition. And I think once people get that, then they start to really move forward and get their life back. Trying to deal with chronic or persistent pain in a 10-minute consultation for a first presentation, so seeing a patient for the first time, I think is just ridiculous, and you just can't do it. So what I've suggested to some of my colleagues is that we split the assessment of someone with persistent pain into 2 appointments at the very least. So the first appointment will be really listening to the pain story, so asking the patient how the pain started, how it's progressed, and then finish with how it is now. Find out the treatments that they've had, okay, to this date, what's worked, what hasn't worked. Find out what investigations they've had. So I think you need to be clear as a doctor that all the investigations that are necessary have been done. The other thing during the first consultation is to explain a bit about persistent pain and why people might have pain which is going on and on, sometimes without there being a definite identifiable cause. When they've had investigations, nothing particularly has shown up, yet they've got very severe pain and very distressing symptoms. And I explain it in that even though the tissue which has been damaged is now healed and therefore may not be evident on scans and investigations, the nerves which are sensing that tissue damage around the area are still behaving as though the tissue damage is ongoing. We're finding out now when we're looking at people using specialist MRI scanning that there are lots of changes that happen in the brain and the spinal cord and the nervous system itself, which means that the pain is ongoing. And so a lot of the things that we do in terms of medications and helping people manage their pain is directed at the nervous system specifically, rather than the original problem that caused the pain. And then the second consultation will be about planning where we're going from here. Okay, so getting an idea from the patient in terms of what they want in terms of going forward. So what is it they're wanting to achieve in terms of getting control of their pain? What difference would that make to them? What do they want to kind of achieve specifically? So at that point, then I would start thinking about, well, the medication that they're on, is it effective? Is there changes that we can make to that? Is there maybe more effective medication? Can we simplify the medication that they're on? So rather than taking lots and lots and lots of tablets, which may or may not be helpful, maybe even start by reducing some of them and see whether they are helpful or not. And if they are, well, we can restart them, that's no problem. Often what happens is that patients don't notice any difference in the pain. The pain is still the same, yet they've managed to reduce their tablets quite a lot. And I'd always advise people to do that before adding on new medications. I mean, there are other things as well which I think are useful. So there are relaxation techniques which people can learn, which are really helpful. Making sure people are pacing their activities, which is absolutely essential. There are other things like acupuncture or TENS machines that some people find helpful and other people don't find helpful at all. But pain is a very individual thing, and so I think as much as possible we want to tailor the treatment to not just the pain but also the individual who's experiencing it.